We're at a pivotal moment both in healthcare and by extension healthcare education, right? With changing demographics, and really the biggest impact of change these days is the impact of technology, AI, machine learning, healthcare, and then the pandemic just exacerbated all of this, right? And we're seeing these taking effect in a whole new way. Here's a contradictory thing, a higher education overall is shrinking, but we're seeing that healthcare education is blossoming. People are inspired. The new generation is truly inspired given the events of the last 2 years, and they want to make an impact, right? And now we have schools of medicine, schools of nursing who are used to teaching in a certain way. And we have new generation coming up, Gen Z, digital natives, as well as a highly educated patient population, because we all use Dr. Google and we use wearables. But it's a new world, so we're finding that schools have to adapt, right? So there's a new world and there are more students, so there's a conflict between old forms of teaching and shrunken spaces because they have so many more students to teach. So we are here to help with that, and we are finding that we have to do things differently and we have to help schools with outmoded spaces. So we're coming in to program and work with every school of medicine and every school of nursing and allied health to truly create bespoke solutions. We program very carefully based on their enrollment, projected growth, their curriculum. Hey, that's a whole new dynamic. They're changing curricula to adapt to the new means of learning, right? We have to engage students who are used to snap information, who are used to getting information on their fingertips. Like, how do you teach them not to memorize, right? Because they don't need to anymore, but how do you still keep them engaged? This problem is especially important for schools of medicine. They have large format classes, 150, 200. How do you engage all learners, right? So we work very hard to create really interesting learning environments that inspire, and also learning environments that can have a uniform and equitable experience both for learners who are in person and blended learning, hybrid learning. And especially with experiential learning, right? It's easier with didactics. You have Teams and Zoom and technology. Medical education is based on hands-on learning, right? It's not just textbooks. So bringing in technology and bringing in the ability to capture information and broadcast it both within the school as well as to remote campuses, to remote learners is becoming very, very important. So we are adding a whole new level of complexity to experiential learning education, which is super complex in itself. It's theatrical, right? It's really cool. So we are working very hard to bring new ways of technology-infused spaces in experiential learning. Another aspect that has come to the forefront now since the pandemic is mental health, right? It's well-being, and it's much more than just physical fitness and active spaces. We are leaning heavily on biomimicry to create nature-infused spaces, and we're also working very hard to create intentional collisions so that people can interact with each other. And with this strenuous curriculum, these are very high-achieving, ambitious students, right? They work hard to get into medical school. They're top of their classes, and then when they deal with super long hours of stressful curriculum, we work hard to give them spaces for respite, relaxation, interaction, everything that will help them thrive. And the same for educators. Like, they're dealing with a whole new world too, and we work really hard to make it better for them. And hey, eventually maybe this will have an impact on the health of humanity, right? And maybe it can be a better world.